Good afternoon, everybody, and welcome to the Telford and Wrekin Health and Wellbeing Board. Due to the current COVID-19 regulations, today's meeting will be held with audio conferencing and available for the public to listen to via the audio feed on the agenda page or our website or via the Council's YouTube channel. This ensures that all those involved or interested in the proceedings can see how decisions are made. Only those people who have been notified by the Democratic Services team prior to the meeting are able to speak on public questions item and will be dialed into the meeting via telephone. If you could all put your yourselves on mute if you're not addressing the committee, please, and raise your hand if you would like to speak on any of the items. To the item agenda item presenters, each item has roughly a 15-minute slot to ensure that all the items are heard within a 2-hour period. If your report was sent in advance, please summarise the main tenets to ensure that there is adequate time for discussion. Also, just to note, if you do need to use your mobile phone, can you please turn off your cameras to do so? I'd also like to thank Carol Hart, who was the voluntary sector representative from the Chief Officers Group, for her work and time and contribution to the Telford and Wrekin Health and Wellbeing Board. Likewise, please welcome the new voluntary sector representative, Alan Olver, who is also the CEO of Man in Place. Okay, so is there any apologies for absence?
Yes, Chair, we have one apologies for absence, Jim Baker.
Thank you. Anybody got any declarations of interest? I'll take silence as a no. Yeah, okay. Minutes from the previous meeting. Can I call for a proposer and a seconder, please? Shirley?
Yeah, I just want to note that on the minutes, I'm actually there present, and I've also got apologies. I was actually at the meeting. I think I'd given apologies thinking I couldn't make it, but I was there, so they will need amended. But you can put that amendment in. I'm happy to propose the minutes.
Thank you. Julian?
Just to say, just in the attendance, I was actually attending. It wasn't Joe Leahy. In fact, that's been altered on this set actually, so that's fine. It was a previous set I looked at. That had, I think the actual minutes, sorry, I've got Joe attending and present, and it was me. And then in declarations of interest, just my title's Dr. J Povey rather than Mr. I don't tend to go by either, but it's not Mr. Thanks.
Thank you. Karen?
Yeah, I was just going to say, with all those amendments, I'm happy to second the minutes.
Thank you. Is everybody happy? I'll take silence as a yes. Yeah, okay, thank you. Public speakers, do we have any?
No public speakers, Chair.
Thank you. So on to the first item is the COVID-19 update by Liz Noakes.
Thank you, Kelly. I just wanted to share a presentation that I've prepared for board members, if you bear with me a moment. Right, so is everybody seeing the presentation? Yeah, okay, thank you. So I just wanted to give you the latest information available in terms of our infection rates, and then a few updates afterwards as well. So firstly, so this is the latest information, i.e. for the week ending the 29th of November, last Sunday. So we had 308 cases during that week, giving us an infection rate of 171 per 100,000. So 2 points therefore to make is that the reduction of 30% on that during that week, a similar rate of reduction to the previous week, which is good news. And what's pleasing is that we've had our rates have more than halved now since our peak in this second wave that was on the 11th of November, where we were at 377 per 100,000. The other point to note is that the rate of decline is slightly faster than the national average. So whilst we are still above the national average and below the West Midlands average, we have closed the gap slightly. I also wanted to share the news around the over 60s, obviously the group that's particularly vulnerable to the complications of COVID. And our rate of decline in the last week has been faster than the rest of the population in this group, which is again good news. And last week I was particularly concerned about high rates in the over 80s. Obviously very small numbers, so that will fluctuate up and down given those small numbers, but that too has come down. So we've had a 41% reduction in the over 60s, and our current rate is at 108 per 100,000. Just in terms of testing rates within the borough have increased significantly and are higher than the West Midlands average, and the positivity rate is also falling and is now 5.5%. And then I just wanted to share a graph in terms of hospital admissions and occupancy. And so you can see this is actually for all admissions to both Shrewsbury and Telford for any person, not just our residents. So it's a totality of the situation at SAF, and you can see that steep rise that has now has started to fall, which is again good news, but clearly still too high. And I think my message is that whilst it's good news that rates are coming down, there's no room for complacency, and we must get those rates down as low as possible before the Christmas period, and follow the tier 2 restrictions, particularly around hands, face and space, and the no household mixing, in terms of making sure we get those rates down as low as possible. Just in terms of update on testing, so a lot's happened since last updated the board. So we now have new walkthrough testing centres at various borough towns. I think I said last time that we were planning these. These are now here. We've targeted communications in the areas of low testing. We have, ahead of the national move in terms of domiciliary care workers, advised domiciliary care workers to get regularly tested using our walkthrough and drive-through sites. And we started to advise precautionary tests back on the 21st of November for those with a wider set of symptoms, in terms of trying to really find cases to get people to more people to come forward and find those cases and isolate to stop that ongoing transmission. We will be starting to roll out rapid testing in the next few weeks within the borough. This is the new form of testing in terms of results being available within 20 to 30 minutes and is for people without symptoms. PCR testing is for people with symptoms, and this is for people without symptoms. So this is where we're really trying to case find individuals so we can stop transmission. We are supporting the care sector in developing their rapid testing going forward as well. I just wanted to say a few words around the care sector. So there's been various national announcements around rapid testing being available in care homes. Certainly communication with the care homes nationally started at the end of last week, with some care homes starting to receive kits. But this scheme has only just started to be rolled out over a number of weeks, and we must really give the care homes the support to be able to do this. It's not an easy thing to just implement straight away, and it is still being rolled out nationally. And we're supporting the extra care and supported living sector to complete the first pilot of whole home testing, similarly to care homes. Nationally, they've only suggested one round, but I would prefer to have those settings regularly being tested as well. And so currently our testing rates are higher than the West Midland average. Just in terms of communications and engagement then, so we've had, as we've discussed earlier, a lot of communications around getting people to come forward for testing, a campaign around for the love of Christmas, particularly, and we've also been promoting what tier 2 means for people, particularly that no household mixing, which is really crucial in this run up to Christmas. And then obviously promoting the support that's available to residents as a result of, from the job box and winter grant support. And clearly every Thursday I publish the case numbers in a graphic form, which does generate a lot of conversation within the borough. Health Protection Hub, which is our hub that supports complex cases, school, various settings, outbreaks, has had a very, very busy November, and I would like to pay tribute to that team for all the hard work and dedication they have during a very exceptionally busy November. And just to say that actually we've added to that team. I think over the last couple of boards, I've referred to that team, and we've added to that team. And actually, what we have done is trained other council employees now to be able to undertake contact tracing in support of that team, and that has been very welcome and been well used during November. And then lastly, I just wanted to highlight the work of public protection colleagues working with the police in trying to support compliance with the regulations across the borough. We target that in terms of using intelligence. We have trained up street champions, council officers to sort of walk the different borough towns to be able to sort of report in issues if they see them to our public protection colleagues. Clearly revenues and benefits are supporting those who qualify for self-isolation grants, because it is really important that we do everything we can to support those to self-isolate and play their part. And then the community support line has been once again mobilised, not being used as much as in the first wave, but it's there for people if they need it. I'll stop there then, Kelly, and take down my presentation and would welcome any questions at this stage, if that's okay with you, Kelly.
Yeah, that's great. Thank you, Liz. Karen, you asked a question in the chat.
I did, sorry. Thank you, Liz. Thank you for that presentation. I've got a few questions. Are we still taking COVID cases at our hospitals? Because I know that we were taking the overflow. Is it from Stoke? I just wondered if we're still actually doing that.
Well, certainly there are COVID cases within a hospital. I think I showed you that slide. I don't know whether, I'm not quite sure what you're referring to in terms of the overflow with Stoke. Julian, did you want to come in there?
Dave's here as well.
Oh, Dave.
Yes, the overflow was, I think, patients when other ITUs were stretching at capacity, and there's mutual aid across the NHS in terms of ITU capacity. So I think overall across the country and across the Midlands, there's plenty of capacity, but certain hospitals are struggling more than others. So Stoke has been struggling at times, as has sort of in Birmingham and Wolverhampton and Nottingham. So there had at some point been a number of patients that were transferred to Shrewsbury, or to Telford ITU and Shrewsbury ITU, but I think they haven't been there for a number of weeks, and they are just the current patients. I think there's sort of 8 patients across both ITUs, I think, with COVID, and 8 with non-COVID symptoms, and I don't think any of those are out of area, but I think Dave has joined the call now, so he'll probably be more up to date with those details.
Thanks, Julian. That is right. At the beginning of the second wave, because there was capacity locally, that capacity was used by a number of other areas, not just Stoke. We've not had any admissions out of area for a few weeks now. I believe a couple of those patients, they're not in ITU, but they are still in local hospitals. But as Julian says, we do have a mutual aid agreement in place, particularly for critical care beds, to make sure that patients are admitted to an ITU if they need to.
Thank you very much for answering those, David and June. The other question, sorry, Liz, that I might be jumping the gun here. Obviously, the vaccine's on the horizon, and we are talking about obviously frontline workers and care homes, the vulnerable. My concern would be is because it's got to be stored at such a low temperature and they're on about, we need to administer this in a controlled environment, i.e. hospitals. How would we be able to bus certain patients from care homes to be able to get the vaccine, because, just talking from experience, we know how difficult it can be to move people with dementia, and also in the home that my mother-in-law's in, there are some that are in bed. So I'm just wondering how that will work. Have we any ideas? Does the government giving us any information at all?
I wonder, I can see David's put his hand up and wonder whether he's going to respond to that question, because the NHS, the immunisation programme is NHS led, but clearly I am being briefed by Angie Wallace, who's the SRO, but David might want to come in on that question.
Thanks, Liz. Yeah, Karen, just to pick up that, there are a number of vaccines which look like they are going to be licensed fairly soon, in addition to the Pfizer vaccine, which was announced yesterday. The Pfizer one in particular is the one which has got challenges around storage because of the temperature it has to be kept at. The reason that's been kept in one place in terms of one vaccination centre is because of the logistical difficulties of moving that around. And so the intent is that vaccine will be used just for NHS and care staff. Yeah. And as the other vaccines come around, which will be in the next couple of weeks, almost certainly, or the next few weeks, they will be more easily transportable, and then we'll be able to start a vaccination programme, both in care homes, but also at the testing centres, at the International Centre, and at the Bowling Centre at the Seven Side site in Shrewsbury, as well as around the county.
Thank you very much for that. Sorry, Liz, I'm putting you on the spot again. Last question. How concerned are we about, I know we will want to see our loved ones at Christmas, but as the conversation I had with my mother, who's 88, I'd rather have lots of meals with her next year than just one at Christmas. I'm just wondering how everybody else is going to deal with this, and how we feel about that situation, and whether we think it's still fluid and whether that's going to change.
So I don't think the national advice around the window around Christmas and the 3 household bubble is going to change. But what I would say, and I think I said on Radio Shropshire yesterday, is that we must all be really careful and sensible about that Christmas period. So whilst it's not a license to mix with in ways that aren't sensible. So I would, if you have symptoms, you certainly shouldn't be part of that bubble. Still continue to practice hands, face and space. Keep your rooms ventilated, those types of things, and really take the most precaution with those most vulnerable, as you've just described your mother. I've got similar members of my family that we should protect. I think, the last thing we want to do is to give COVID for Christmas. So whilst it's welcome to be, allowed to celebrate, we must all be careful and sensible in our approach around our family celebrations this year.
Thank you very much for reiterating something that I feel is very important to give that message to everybody. So thank you very much.
Thank you. Andy Burford.
Yes, thanks, Karen. Just really picking up on the issue of public expectations, really. Liz alluded to it in terms of care homes and the ability to get rapid testing. It's all very well for government to make statements about what they want to see and what they expect to see. It's another thing to get the logistics on the ground right. You may have heard, if you've listened to the radio this morning, how care homes are struggling in terms of the administration of those rapid flow tests. How many of them haven't had advice about the use. Some of them haven't had the tests, although they were expecting them. So this kind of situation is, unfortunately, it hasn't been uncommon, shall we say, over the last year. The effect is, despite the flat-out efforts of our staff and the care home staff, is to undermine confidence if we're not careful. The same can be said of the vaccination programme and what's possible there. Obviously, with the Pfizer vaccine having to be stored at such low temperatures, there were always going to be issues with that. And sure enough, it's only really hospitals before Christmas that are going to be able to manage that and to actually get that and get those vaccinations done. The AstraZeneca one we know hasn't been approved yet, although as David says, soon. But again, there's expectations, isn't there, out there that these vaccines will be in place and we're going to be starting to roll them out before Christmas in a very limited way. And again, because it's not moving at the pace that people want, there's a danger that expectations aren't fulfilled. Confidence is under. It perturbs me and annoys me that this has been a characteristic right the way through this pandemic, that we've been trying to catch up with the statements made nationally. I mean, our staff, as Liz highlighted in the presentation, and those NHS staff have been working absolutely flat out on this, and still are, and they need our support and our appreciation. It doesn't help when we have this kind of mismatch between what's possible on the ground and what government think is possible. Thank you.
Thank you, Andy. Paul Watling.
Yes, I just wanted to thanks for the report, Liz, and just say the work of the community teams in alongside the hub has been really benefited the community across Telford and Wrekin over the last this period of lockdown, even though it wasn't as busy, as you say, as it has been in the past. The fact that our partners from the voluntary and community sector have been there and working with us on all aspects of supporting our communities, whether they be sort of in the local community or whether they be people coming to the town, it's been really, really positive, and I want to say thank you through the through your report to them for their support, and I'm sure that will get back. Thank you.
Thank you, Paul. Ian Fletcher.
Thank you, Chairman. So I had to put my microphone on. A couple of questions. I noticed that the precautionary testing is being widely advertised throughout the borough. What percentage of the testing is being utilised for precautionary testing, and is there still capacity? Is the first question to Liz. The other one is to the South Hospital discharge policy. I understand that if you go into hospital, when you come out, you've got to isolate for 14 days after discharge, whether you got COVID or not. This could have a rather detrimental effect on, say, teenagers who are at school. Is that policy likely to be reviewed? Thank you.
Liz.
So in terms of the precautionary testing, I haven't got the specific proportion, Councillor Fletcher, that you've asked for, but it has been taken up and there is still capacity within our testing centres to be able to do this. Just in terms of saying, over the first few days of when we launched, actually about a third of our positive cases had come through that route. So it was certainly worthwhile, and we certainly still have testing capacity within the borough. I wonder whether David could answer the second point in terms of the discharge.
Thanks, Liz. Just for information, the requirements around discharge are national requirements, they're not locally determined, and that is about trying to ensure that populations at large are protected as far as possible, because of course you can't be sure if someone when they are discharged, if they are asymptomatic, has COVID or not. So we are following national guidance from PHE on that.
Thank you very much indeed.
Thank you. Alan Olver.
You've spoken about priority around care homes, Liz. Has any consideration been given to those who are living in homeless supported living schemes and other homeless provision across the borough?
In terms of testing, are you referring to?
Yes. Yeah.
So no, in a sense, nationally they have rolled out a first round of whole home testing to those in supported living or extra care accommodation. But I recognise you're talking about a wider group than just that. So that's certainly something we can take away, Alan, and I can liaise with you outside of the meeting to see what we can do.
Brilliant. Thank you.
Thank you. So any more questions? I assume the hands up are from previous. Is there any more questions before? No? Okay, thank you. Now we're going to receive a report from Armadeep on Care Act flexibilities.
Hello everyone. I'll just do a quick introduction. My name's Amaddeep. I'm a service delivery manager and the principal social worker for adult social care in Telford and Wrekin, and I'm just come today just to briefly talk about the Care Act easements following the Coronavirus Act, which was enacted in March earlier this year. I understand there's been a previous update to the board, so I will be brief. Thank you, Sarah. Okay, so our local arrangements in respect of the Care Act easements continue to be at stage 2, and that means for us that we have enacted some flexibilities within our duty of care of the Care Act. We haven't changed significantly in respect of the care and support we deliver. The main changes, which I'll go through, are around how that care and support is delivered and how our frontline workers are practicing. When the easements report was first completed, and myself and the DAS, Sarah, Dylan meet on a regular basis to review the easements that we have in place. They were completed in line with our ethical framework for adult social care, which was published around the same time, which talks about and lends us to consider our actions in a reasonable way in respect of the impact on individuals and families. So as I said, so we continue to be at stage 2 of the flexibilities. That does impact on some of the types of service that we commission, and the changes have been around delaying or cancelling some services. So within the easements, there's 4 that are permitted under the legislation. And we have continued to do additional activities to support individuals and families at this time, as well as we have done throughout the previous lockdown. And in fact, when we came out of that lockdown also. Thank you, Sarah. So firstly, we were permitted not have a need to carry out detailed assessments for individuals. And one of the main impacts that we saw on our frontline practice was in respect of the visits that we were doing. So in order to support and work within social distancing measures, we provided a platform of ways that we could carry out those assessments and conversations that we were having with people. So we did some over the telephone, we did some through Teams, and we also used Zoom. Now, one of the key points to make is that we did not use the flexibilities to change our delivery of care and support. So staff were supported with having PPE to carry out those essential visits. We had previously suspended all non-essential visits, but those, as we came out of lockdown, staff have been using PPE to continue to see people face to face. All of our staff have to complete a pre-visit questionnaire, which goes through a very brief risk assessment on where they're going, and it's very much dependent on whether they're going into a person's home or if they're visiting somebody in a care setting also. So we made a decision very quickly as well that we would have no amendments to our assessment paperwork or our business processes. Now, what that means was that as we would have carried the assessments out pre-lockdown, we were doing the same. We were just using various different platforms in order to gather the information that we needed to inform those assessments. So the level 2 was about financial assessments, and the Care Act requires leads local authorities to carry out financial assessments on individuals who access adult social care services. We made a decision for a 3-month suspension on client contributions at that time, but what we didn't do was suspend all the assessment information and gathering. Now, one of the reasons we did that was because we were very mindful of the impact that that possibly may have once we got to business as usual. So those financial assessments continued to take place, but there was a 3-month suspension on collecting client contributions for people who were living in the community. Thank you, Sarah. Okay, so the easement number 3. So this was in light of our reviewing of people who were in receipt of services. So where we would previously have carried out visits, etc., as we seeing people face to face, again, we used the same principles that we identified various amounts of platforms to enable us to carry out those assessments. And we also provided a level of flexibility in those reviews, whereas our statutory duty was to review people on an annual basis. Where it was deemed appropriate and necessary, those reviews were brought forward. So we were having conversations with people on a regular basis, especially those whose care and support had been affected. And again, there was no amendments to our processes in respect of the reviews. We followed the same processes as we had done previously. And finally, the 4th amendment, which would have allowed local authorities to change the eligibility criteria and the way that services were delivered to people following assessments, so that there was the power to remove some lower level care and support that people were receiving, and we were very fortunate enough that we did not have to enact this at all, and we've been fortunate enough not to have enacted this at all. So everybody's care and support has remained the same unless it's been affected by social distancing measures. We were also, again, very fortunate. People have spoken about frontline staff, and we were very fortunate that we had low levels of very low levels of sickness within our frontline staff. No positive COVID tests were done for our staff. We have had a few members of staff who have had had to have the tests, but none have come back positive. And we supported our frontline staff who were also shielding as well. And I suppose the fourth easement is the one that we would have to would have the biggest impact on individuals and carers. And like I said, we were fortunate that we didn't have to enact any part of this easement. Thank you, Sarah. So there was, as I alluded to previously, there was a number of tasks that we had to do to ensure, as we went into lockdown the first time and the second time, we had a lot more contact with individuals. A lot of this contact was over the phone. We ensured that we contacted everyone who was in receipt of a direct payment, for example, and we continued to do work around personal assistance being tested as to support people who receive their care and support via a personal assistant rather than through a domiciliary care agency. And we have an internal list of vulnerable people who we identify that would need additional contacts at times where there may be circumstances where their care and support could be changed. So we made sure they were contacted on a weekly basis as well. We worked very closely with the carers centre to ensure that we were making contact with carers known to adult social care, but also carers that were registered with the carers centre that may not have been known to adult social care. And there was regular contact for our people with a learning disability who were impacted by the changes to day services provision. And then we worked with MPFT and the Autism Hub to contact people who had an autism diagnosis. And then we also worked with our colleagues in MPFT to contact everyone with the dementia diagnosis as well. And our OTs continued to make contact for those who were waiting occupational therapy assessments as well. And there's just a very small list there of all the positives that we put in place due to COVID, and we continue to look at the areas of our practice which have been impacted, but impacted in a positive way, is something that we can take forward and not lose. Thank you, Sarah. I think that's the end of my briefing. Like I said, we continue to be at stage 2 of the easements, and myself and Sarah and the other SDMs meet on a regular basis to consider if and what impact any changes will have on social work practice. Thank you.
Thank you. Anybody got any questions? No? Oh, yeah, Andy.
No, just to say, I mean, I think that gives you a flavour, Amadit's presentation of the extent of the work we've been doing locally with those we'd have often had to support by other means. But some of the learning that we've had in the process is something we can carry forward in terms of the way we interact with people in future. But I hope you can see from that we've covered the ground very well in terms of what we've had to do. And unlike other authorities, we've managed to minimise the effect on services by not going up the levels in terms of what we had to do and what we had to cut back upon, we've managed to keep things going very well, I think. So I think that's an excellent presentation, Amadeep. Thank you.
Thank you.
Thank you. Ian Fletcher.
Yes, thank you, Chairman. In your presentation, you mentioned that you had to cancel some services. Which services have you had to cancel, please?
Okay, so the services that were impacted were mainly around day centres due to the social distancing measures. And what we did was we made contact with every single individual and carer who was impacted by that day centre closure or reduction in numbers in attending that day centre. And what we've been able to do is identify alternative support for those individuals. And we've seen, I think it's safe to say, we've seen carers, unpaid carers, that have been absolutely phenomenal at this time, but we're very conscious of the impact on carers also. So we have looked at alternatives where alternatives have been available, and that's been a range of things. Our in-house learning disability My Options service, for example, launched a really comprehensive online virtual weekly activities. We also created smaller social bubbles for individuals with staff to access the community, and where required, we also supported people on a one-to-one basis as well.
Thank you, Chair, for that reply. In the presentation that was sent out to us, there was a mention about delay in DFG applications. What are DFG applications, please?
So a DFG is a disability funded grant, and that's supported through our housing colleagues. If our occupational therapists, when they go out to do assessments, they'll identify if somebody would benefit, for example, from a wet room or a downstairs toilet or shower. And those works are carried out through what we call a DFG grant. It's a means tested grant that provides monetary value towards the works being carried out.
Thank you. Thank you, Chairman.
Thank you. Thank you very much. Okay, the next item is the winter planning update. We're going to receive a report from Sam Tilley and then a report from Sarah Dillon. And then I thought we'd get questions at the end of them both. So we'll just do them both first. So Sam Tilley's report, please.
Thank you. Hopefully everybody can hear me okay.
Yeah.
The report itself was fairly self-explanatory, I think, so I won't take too much time to go through it. Maybe best to spend that time on questions. However, following on from the update that I did at a previous Health and Wellbeing board, we've continued with the process of developing our plan. We've been through a process of refinement in terms of specific winter schemes in order to identify a number of high impact schemes that would have the greatest impact in terms of managing winter capacity. You'll see from the report that those schemes around a particular number of themes have now been implemented, some during November and others during December. We've had 4 schemes that have not progressed as fast as we would like due to recruitment issues. But by and large, all the schemes are now at a stage of implementation, and we'll be monitoring those as the weeks go on in terms of their impact. So, I think linking very much with the COVID report that was presented by Liz, winter this year is already very challenging. in terms of our overall capacity, and you'll have seen from Liz's report that there are some pleasing signs that activity levels are reducing in terms of COVID. However, COVID is only part of the picture, as I'm sure you'll appreciate. So in this second wave, we are seeing a slightly different manifestation in terms of COVID presentations within the hospital. Not so much demand on critical care, but a greater number of patients on oxygen and staying within the hospital longer. So coupled with the social distancing arrangements and IPC arrangements that we have to have in place, plus slightly elevated staff sickness levels compared to what we would normally expect at this time of year, we have got a very demanding situation. However, we anticipate that the schemes that we've put in place will undoubtedly help with managing that capacity. So I'll probably leave it there. I'm sure Sarah may want to, in her report, talk about the some of the those schemes on the ground, and then I'll have to take some questions.
Thank you, Sam. Sarah?
Thank you, Kelly. We're just putting the slides up, Sarah. Thank you. Okay, so just following on from what Sam has just updated on, really, focusing more on the adult social care contribution to the wider system winter planning. Thanks, Sarah. So this year, as Sam said, from the middle of the year, every year, adult social care and partners in the NHS work on our winter plan. This year, there was an additional requirement on adult social care to submit a winter plan to the Department of Health and Social Care, or to submit an assurance that we'd taken necessary actions. So you can see in the blue box there, the list of actions that we were required to provide assurance on. Obviously, there's the infection control funding that was made available for the care sector. There was the whole issue, which Liz has mentioned, around testing. There was the PPE aspect of the support and the vaccination programme around flu. An important area which Amardeep touched on earlier was around safely opening daytime support and respite where suitable for people with care and support needs. And Amardeep talked about how we've continued to provide that service. There was continued prevention around admission avoidance, supporting safe and timely discharges, and then restarting the continuing healthcare process for people who needed that level of support. And obviously, as Liz has mentioned previously, there was the regular assessments around visiting care homes. Thanks, Sarah. So in terms of linking in with what Sam has said earlier, from a Telford and Wrekin perspective, we work regularly with system partners around demand and capacity modelling of care and health requirements in Telford and Wrekin, and that's really important because it helps make sure we've got the necessary care and support available for local people in the right place and at the right level. Obviously, an important part has been monitoring the flow of people as they go through our enablement pathways, whether in terms of avoiding unnecessary admissions to hospital or in the discharge from hospital pathway. We've got regular contact points through the week with the ambulance service around 111 and 999 to ensure that we're really maximising on avoiding unnecessary admissions, particularly in the older age group. And that's working really well at the moment to divert as many people as we can through our integrated rapid response team. A big important role at the moment is supporting our staff resilience and wellbeing. This being the sort of second wave and the impact that has on our staffing frontline provision. I've already mentioned about the rapid response integrated team, which we have in Telford and Wrekin, which is really important contribution and has been supported by the wider system plan that Sam mentioned to extend its staffing at the moment to, again, avoid people going unnecessarily to hospital, particularly in the older age bracket. And our TICAT service, which is our integrated hospital discharge team over 7 days, really supporting people to get out of hospital as safe as possible, as quickly and as safely as possible on the enablement pathway. Amandeep mentioned earlier that we've continued to work with partners around mental health and learning disability, using virtual platforms like this to do interdisciplinary working, again, with a focus on supporting people early and avoiding higher levels of care or avoidable admissions to hospital. Amandeep mentioned as well around learning disability support, and particularly for individuals and their carers. And we've worked really hard to ensure that we continue to provide that daytime support in our buildings for those people with the most complex of needs, albeit provided very differently because of the social distancing requirements. We've worked closely with our Carers Partnership Board and the Carers Centre to make sure that we're in regular contact with carers and that we liaise about any areas of concern, and we can flex our services around individual needs. And we've worked with the demand and capacity modelling with the system to add additional beds and domiciliary care where that's been required. Thanks, Sarah. And Sam mentioned some of the schemes that have been agreed as part of our winter plan. And from a Telford and Wrekin perspective, you can see a list of the items there. So we've got a small scheme of living carers to support people going straight home, which is our preferred choice for most people, going straight home to their own beds. But for those that need overnight care, we've got a service that can support people in the short term. We've got 2 carers in the car that is out of hours as well, supporting people with care and support needs. And we have looked to provide additional funding for those domiciliary care agencies supporting people leaving hospital affected by the pandemic. We've supported people on Pathway Zero, which is our strength-based approach and using local community resources from our voluntary sector. I've mentioned before, we've purchased additional care home beds when required, some of those being designated COVID positive settings within the regulations. I've mentioned about increasing the rapid response capacity, and you can see a list of the additional supported items in the system there. From an adult social care point of view, we've added additional resources through our out-of-hours service for approved mental health social workers. We've had additional mental health social work capacity in supporting our Calm Cafe initiatives, which is providing early help and advice for people with mental health issues. We've added additional capacity in our social work team, in the hospital discharge team, and we've recently got temporary funding for a carers social worker to ensure we continue to provide carers assessments. Thanks, Sarah. And in addition to that side of operations, we've also importantly supported our care provider market and settings with our commissioning teams under Liz Noakes, contacting our care providers on a weekly basis, continuing to look at quality monitoring visits, liaising closely with Shropshire Partners in Care and system partners. We've had joint communications out to our care providers. And as I mentioned earlier, we've got the support around the testing and the PPE. Thanks, Sarah. And that's the end of the presentation. Happy to answer any questions. Thank you.
Thanks, Sarah. Alan Over, you got your hand up.
Yeah, can you just clarify why the severe weather emergency programme is not included in this for the homeless and those living on the streets?
I suppose I've just responded to the specific adult social care winter planning aspect, but you're quite right, there is additional support there as well for people affected by homelessness, which the wider council supports.
Could we see that included in future reports?
Yeah, absolutely.
Okay, thank you.
Thank you.
Thank you, Alan. Has anybody else got any questions? No? Okay, thank you. Next is the Health Watch Telford annual report with Paul Shirley.
Hello, could I just come in, please? It's Barry here.
Hi, Barry.
Barry Palmy. A few words before Paul comes in. First of all, apologise for my dog joining in the board meeting. It got a bit boisterous, and it's one of the joys of working from home. As interim chair, having took the post a year and a half ago, it's still interim, seems to go on forever. It's my pleasure to present the report, which I hope members have all read. It should have come to the board post-April, but like everything with COVID, it was put back a bit. Paul, our manager, I'm going to ask him to go through the salient points of the report and to highlight some of the priorities that the board have earmarked that we need to work with this year and beyond. So I'll hand it over to Paul now. Thank you very much.
Thank you.
Sorry, I've just remembered I've got to turn my mute off. First of all, thank you for giving Health Watch Telford and Wrekin the opportunity to share our annual report for 2019-20. It is slightly late, but hopefully, as Barry said, members should have received a copy of the annual report, which has been delayed due to COVID. Throughout the year, a staff of volunteers attended statutory meetings, the board and committee meetings, and these have included working in close partnership and collaboration with local authorities, health and wellbeing boards, safeguarding boards, clinical commissioning groups, Shrewsbury and Telford Hospital and other organisations. Our presence was also evident at several other meetings as well concerning hospitals reconfiguration and the system transformation programmes that are ongoing. The staff team also set up virtual and digital systems. Like everybody else, we've had to adapt to allow people the opportunity to leave us feedback about their experiences on health and social care services, thus ensuring that people had an opportunity through public engagement. So in terms of last year, 2,118 people told us about the improvements they would like to see in health and social care services within Telford and Wrekin. And this is for 2019-20. And out of people's comments, we did identify some common themes, which we've actually put into our 6 priorities for the year ahead, based on what people did tell us. So we're sort of looking at how specialised and acute services will be provided, particularly around restoration of these services, which people did have concerns about. How mental health services will offer support to people. That is quite a significant area of concern amongst people, particularly as we're sort of moving into, with people being lonely and isolated and being locked down. In terms of adult social care, it's about how services are providing support to people and their carers during COVID, but also pre-COVID and after COVID. How primary care will support people through different ways of working. There's a lot of talk around digital means, particularly with doctors engaging with their patients through use of video calling and mobile phones. We also heard about learning disability and autism and people with long-term conditions, and that came out of our long-term plan survey work that we did, which was a joint venture with Health Watch Shropshire and the local STP as well. In terms of exploring prevention and place-based approaches, we've been on various meetings with the council and local system providers and to see how place-based approaches would work for people. So in terms of Healthwatch itself, we've got 23 trained volunteers to help carry out the work that we do. And in total, they gave up approximately 1,244.5 hours, which equates to approximately 168 days of their time supporting Healthwatch activities. On top of that, we do employ 3 staff still, which has remained unchanged for a number of years now. And that equates to roughly 2.6 full-time equivalents. Our funding also has stayed the same as previous years, despite rising costs. So in terms of how people have sort of accessed Healthwatch and Telford and Wrekin services, 1,196 people access our services in terms of advice and information. This was mainly done online or contact through telephone calls with ourselves, which was up compared to last year. Most of the increase that we did see was around primary care services and the hospital services as well. We also had people who engaged through our website and via our social media platforms. So we reached out to about 140,000 people, or certainly hits on our social media platforms. So this could be responding to things that we put out or sharing items with their contacts as well. And on top of that, we had 1,938 people who we engaged with at social events, community events, but due to the impact of COVID, that has since stopped since March time. So our engagement side face-to-face has been severely impacted. We've published 15 reports about different things, mainly interim view. But we've also produced some other reports as well, and we made roughly about 71 recommendations for positive changes amongst services. Between April 2019 and March 20, we carried out 65 face-to-face activities or engagement activities, communicating with people through various means, and out of that we received about 561 comments and views through the feedback centre that we directed people to. On top of that, we've also attended 249 essential meetings, or what we class as statutory or non-important but statutory meetings, just to make sure that we actually represent the people of Telford and Wrekin, or engage with people and find out what people are saying, so we can feed back to people who actually commission services. So out of some of the key activities that we've sort of done, some major pieces of work have been the NHS long-term plan. We've also engaged with and recruited volunteers for the Maternity Voices Partnership, which is a joint venture with the local maternity system to enable mothers and partners to provide feedback and information on maternity matters. This is working very well at the moment, and we've actually got 13 volunteers with a chair, 2 vice chairs and a team of volunteers onto that. And it's actually Maternity Voices Partnership is not just relating to Telford and Wrekin area, it's also across Shropshire as well. And they'll be doing quite a bit of work, particularly as we wait for the Ockenden report to come out. And I'm sure that work will greatly increase over the forthcoming year. We also carried out a report and a survey regarding maternity mental health and also end-of-life care as well. So moving ahead, really, just to with our 6 priorities in mind, we're going to continue to work with people and talk to people and engage with a range of system providers and commissioners, but mostly the patients and the residents of Telford and Wrekin, to explore their views and seek their experiences. So we're looking particularly around mental health services, around CAMS, acute admissions into hospitals, the digital solutions that are ongoing at the moment and developing rapidly, medication and therapies, and also suicide and out of hours support. particularly from COVID, was about the specialised services such as cancer care and other key normal health services that are operating and make sure they're operating safely in hospital. So a lot of engagement with the clinical commissioning groups and our local council providers, commissioners are really important. Acute services, so again, hospital transformation plan is ongoing. We're also looking around the emergency department or A&E work, urgent care support, clinics and any outpatients and planned care. We're looking at primary care. We'll be gathering people's feedback on people using the services, and particularly around joining in primary care networks and working around digital technologies so we can make sure that people voices are actually heard. We've heard from previous speakers about adult social care, so particularly around COVID-19 and PPE, test and track and trace. We've also heard about people with isolation and loneliness. So it's about how we can sort of support or get services to support people. Another key area that we'll be focusing on would be about carers and unpaid carers, particularly around their home care experiences and also the quality of services that they would receive. We'll be focusing on other areas as well, around long-term conditions and support is offered to people. We'll be doing a piece of work around learning disability, and we were certainly using our entry and view to go into learning disability care homes and services to engage with people and find out what their experiences are like. That was something that we had planned pre-COVID, but then unfortunately COVID came in and we had to stop all our entry and view visits into such services. But it'd be something that I've spoken to Sarah about how we can get back into learning disability services and talk to people, and one of the key ways would be about digital means. And again, Maternity Voices Partnership, we'll be providing and continue to provide operational support to the volunteers covering across Shropshire, Telford and Wrekin to ensure that that mothers and their partners' voices are heard and they're provided with the most appropriate information. And that completes my report. Thank you.
Thank you, Paul. Karen Tomlinson.
Thank you. Just switching everything back on. Thank you, Paul. Also, I'd like to say thank you to Barry for being interim for all that length of time. So I think you're doing an absolutely fantastic job. So, Paul, thank you very much to all your staff and all the volunteers that do this service. I've read it thoroughly. There's a few things obviously a little bit alarming. The fact that both my husband and I have been carers and still are at the moment. Certainly with carers means such a lot, and I think that they need a voice. I'm sure Alan will pick up the end of life care, the fact that some homeless people felt that they weren't treated particularly well by doctors. That was quite a bit alarming, really. We always think end of life, having a friend and a nurse who dealt with end of life, you always think that it's all done really well, but obviously there are still areas that need a bit of attention. So it's not so much questions, it's just you know, I think it's a great report, particularly now that you've got maternity matters as well. I think that's very important as well. There's a lot of people that get mental health issues, particularly not just during, but a lot. I have friends who had what they used to call baby blues, where they're quite suicidal. So I'm really pleased that we are looking into that, or you are looking into that area. But I'd just like to thank you, really, rather than ask questions, for the work that you've done. It's a fantastic, comprehensive report. Thank you.
Thank you very much.
Thank you, Karen. Andy Burford.
Yes, thanks, Kelly. Yes, my thanks to Barry and Paul and the Health Watch team for a really comprehensive report that illustrates just how broad a range of subjects they've covered in the last year. I just wanted to focus on a couple of aspects of your plans for next year, which I just wanted to highlight, really, and I was very pleased to see in there. One you talked about cancer services. I mean, that's always the issue that amidst all of the COVID demands we're most worried about. I think David Evans will confirm we have done pretty well on that by and large, according to the data that we're getting in terms of still managing to provide a service. But it is a constant worry that with the extreme pressures that are on the health service, some of that will slip. And it will be something that I think is well worth Health Watch looking into in the coming year. I suppose not just cancer either. It's all the other essential pathways that the system is responsible for, to make sure that there is no slipping away of those services, because we're not out of this pandemic yet, as we know. On that note, Macmillan Cancer Support have just produced a report which you may have seen, Paul. If you haven't, I can forward it to you. It's got a useful checklist in there under its recommendations in terms of the kinds of things you might want to ensure the system is still delivering upon. I'd be very interested when you pick that bit of work up. The other one I just wanted to highlight was, you mentioned CAMS, Child and Adolescent Mental Health Services. The Joint HOSC recently had a meeting where there was a clear mismatch between the experience of users and what the providers thought they were doing well. Again, that's fertile ground for Health Watch, I would have thought, in terms of investigations in next year. We need to close that gap, I think, going forward. So they're just a couple of things which I was really pleased to see in your forward plan. But congratulations again on the report.
Thank you very much. Thank you.
Thanks, Andy. Can I just make sure everybody's not talking is on mute, because I'm just getting a bit of background noise. I don't know if you can all hear it, so that's better, isn't it? Thank you. Paul Watling.
Yes, thanks, Kelly. I welcome the report. Very, very comprehensive and positive report on the work that Health Watch does. And I wanted to echo what Andy said about mental health services and the fact that you are looking at that issue. I think it's really important for the future and for where we are at the moment in terms of how we're looking at working together, both a non-professional and paraprofessional way to support across communities with mental health issues in terms of prevention. Really, we're aware of the figures of young men who take their lives in Britain as a whole, but I think at these times, these difficult times, it's really important that we're looking at how we work across the sectors to support each other in this area. But I welcome that you're focusing on different things. That's really positive.
Thank you. So is there any more questions or no? Okay, that's great. The last item. Barry, are you on mute?
Yeah, I was just. Can you? No, I'm not. Can I just say I'm listening carefully to what we've heard from Andy and others on their priorities, which fits in with what we think. We're looking at our work programme, and CAMS is probably one of the first on our agenda. So we will be liaising with all the agencies to take that one forward. And the beauty of Health Watch is it's an independent voice. And it's got the statutory clout behind us. So we will be doing that, and we'll report without fear or favour on those issues. And that's how we find out our priorities when we hear from scrutiny and others. Whether it be the homes or others, we pick up particular areas where we need to follow up. So thanks for that, and we've listened carefully to what you've all said.
That's brilliant. Thank you, Barry. Okay, the last item is the local plan issues and options presentation from Gavin Ashford.
Hiya, I'll just share my screen to put the presentation up. Won't be a second. Okay, so my name's Gavin Ashford. I'm the Council's Strategic Planning Team Leader. I look after the team that deals with the local plan, so that's land use planning within the borough. Just to kind of give you a bit of a kind of starting point for those who are not close to planning and that kind of area of work. We're doing we've started a review of the local plan. Just as a bit of background, the local plan is the starting point for determining planning applications in the borough. It contains land use allocations, so this is areas of land that we would look to build housing or employment sites. We're obliged to review the plan within a 5-year period from adoption, so we need to kind of commence that process and kick it off. In terms of the review, we need to consider changes in circumstances, also legislation, and to reflect local priorities, and I think there's been a fair bit of that recently. The issues and options stage. So what does it cover? It's the first stage of consultation. So this is the first point we're going out publicly to stakeholders and to the public, and we're looking for them to contribute and put proposals forward for taking part in terms of the review. There'll be further opportunities to input as the review progresses. So the next stage is the preferred options consultation. That's when we'll have a kind of redrafted plan, but also site allocations as well going alongside that. The issues and options proposal document contains proposals for amendments to planning policies, but also some new development management policies where we feel that there's a need for those. It also sets out the levels for options for the levels and distribution of growth. Part of it, I think, is it doesn't identify specific developments at sites at this stage, but it identifies more globally across Telford, Newport and the rural area, levels of growth and potential options for the distribution of that growth. Also, in terms of existing site allocations that have not yet been not yet gone through the planning system, those are carried forward as part of the plan and as the plan progresses. When we started the process working with cabinet members, there were 4 key issues that were identified, objectives that were identified. These were inward investment and job creation, a forest community approach, so going back to looking at the protection and enhancement of the natural environment and green spaces, looking at regeneration of borough towns, new town estates and infrastructure, and also affordable housing and how we can deliver more specialist and supported accommodation through the review process. Just concentrating on kind of health and well-being in the local plan. So these are some of the areas that we're looking at as part of the review that have a kind of health and well-being kind of, they influence health and well-being. We're looking at things like climate change, off the back of that, air pollution and physical activity. So you've got we'll have proposals in the document around electric vehicle charging infrastructure. So recognise the need to kind of to start to secure that through new development. We're looking at how we can improve options for sustainable travel. We're looking at things like urban greening. So this is a new policy where we can be prescriptive about the amount of green space and green infrastructure that we'd like to see on urban development sites. We're also looking to encourage renewable energy provision across the borough. We're looking for land allocations that are attached to renewable energy sites as well. Green spaces, so we're concentrating on reflecting changes in national government policy. Some of these are things like biodiversity net gain, so that's where we can secure contributions from developers for either on-site provision or off-site provision of biodiversity enhancements. We're looking at where we can take forward the council's programme of designating local nature reserves, so protecting additional green space in the borough. And also, a key part of this will be looking at how we protect interconnected green space. That's for people to move around the borough, but also kind of flora and fauna to kind of move around spaces as well. In terms of better homes, there's obviously, lots of people are working from home at the minute. Part of that is understanding, what's the impact of that potentially going to be. Things like space standards. We currently use the government's space standards for housing developments. We might want to look at those and review those. Also, amenity space. So one of the proposals in the document looks at the provision of amenity space within development, and also how we protect garden land as well from unwanted development. Supporting specialist accommodation. So the council are doing work around the evidence base for this, and that was kind of floated as part of the housing strategy. So we're linking into that, looking at how policy can be amended to secure a better mix of housing within the borough. And we're also working very closely with the public health team and Liz's area around public health issues. In particular, one of those is around how we control uses in town centres. So what we don't want is where we're seeing kind of a move away from some retail in town centres. We don't want to see an overdominance or predominance of certain uses such as takeaways. So we need to control uses in town centres, but we also need to encourage uses that bring in footfall, and we also need to be flexible in how we do that. So we're having discussions about how we can achieve that. In terms of employment, so job creation, we'll be bringing forward further land allocations for employment sites. So that will allow us to create new job opportunities, hopefully grow the kind of workforce of the borough, or provide new opportunities for people. And in terms of infrastructure, we're working closely with the CCG, education, and the council's internal transport teams on infrastructure planning. We're starting that early discussion with these areas, and part of it is about giving them the earliest possible opportunity to kind of see what proposals are coming forward, and to work with them in terms, especially in terms of land allocations and where those kind of might fall, and what opportunities there are for their services, and helping them to plan their services moving forward. Just moving on then, in terms of the council's employment land requirement, so this is the land that we would seek to bring forward for new investment opportunities for inward investment to the borough. We're proposing an employment land requirement of between 167 and 189 hectares. We currently have 90 hectares of employment land supply. So this is made up of the land allocations in the current local plan, as it currently is. Some of that's got planning permission but not yet started, and some of that hasn't yet got planning permission but will be carried forward in terms of the land supply. So what we need to find in terms of additional land for employment is between 77 hectares and 99 hectares of land, when you net off the current supply from the requirement proposals. What that would give us in terms of land for new inward investment inquiries, it's between 125 hectares and 147 hectares. So that's worked out. If you take off the 42 hectares that have got planning permission off the proposed employment land requirements, that's the kind of net effect in terms of the land that's available for new investment inquiries. Just in terms of housing requirement options, we're consulting on three requirement options at the minute. These are between 2020 and 2040. The first line, this is land. These are houses we would need to find land for. So the first option is 8,000 houses. The second option is just over 10,000, and the third option is 14,000. Now, what we do in terms of working out the council's employment housing land requirement or housing requirement would be to add on sites that have already got planning permission but have not yet started. So we've got around 9,000 of those. So over the 20-year period, the housing land requirement would be the figures on the bottom line. So just under 17,000, around 19,000, and 23,000. So those are the three options we're consulting on at the minute. We also need to look at the options for the distribution of growth across the borough. So we've got four options here. They're split between Telford, Newport and the rural area. These are the kind of blocks that we plan for in terms of where the housing goes. Of the four options, the first one is our current strategy. So that's based on a pro rata population split across the borough. You've then got an alternative to that, which is to put more growth into the rural area to test that. The third option is around more growth into Newport, and then there's a balance of growth in Newport and the rural area coming out of Telford in the fourth option. So in terms of how you can contribute, the web address is there for the local plan review. So we're looking for stakeholders, organisations, individuals to add their comments onto the local plan review, into the issues and options document. We're looking for views on policy proposals, planning issues that are important to your organisation, whether it's land use planning, so around sites, or whether it's around policy proposals that we're putting forward and we bring forward into the next stage. And where you've got evidence that supports your comments, that's always very useful for us in terms of backing up and taking things forward. And we're also seeking views on the options for the levels of growth and the distribution of growth in the borough. Just in terms of the next steps then, the consultation period runs until the 8th of January, so there's time to comment still. We've been concentrating and focusing efforts in terms of web and social media activity. We've had direct engagement with parish and town councils and other stakeholder organisations, meeting with them and also kind of responding to direct requests. The next stage for the process is summer 2021, which is the preferred option stage. That's when we're going to have a redrafted plan plus the site allocations for housing and employment land. Any questions?
Thank you. If anybody's got any questions on the health and wellbeing section of that, I'm just mindful that we don't get into the realms of planning on here in questioning. So if there's any on health and wellbeing, then Karen.
It's just a general question. I think Gavin's already aware, and I've done a private message to him. It's not very clear. The link that you've shown up, we've had residents complain, so it's going to affect everybody who tries to actually use that link. It's not very clear for people to actually access it, and these are people with good IT skills.
Yeah, we're addressing those issues, Karen. We've had a chat with our suppliers and we're dealing with that. I've already spoken to Gemma Everson as well. And,
you have, yeah.
Further information will go out to Gemma by the end of the week.
Could you also put that out to Bill and myself, because we've advertised that link, so this will affect everybody who wants to try and comment, whatever it is, Kelly. Yeah. It's not very accessible to anybody, and we're advertising that as a link. Okay. And if people can't access it, it's not very. It doesn't look very good on us, really, does it, as a council?
No, that's absolutely fine. We can do that as well, Councillor Thompson.
Thank you.
Thank you, Liz Noakes.
It isn't really a question, but it's just to say, in terms of the local plan and how we use our land and how we can create healthy communities does depend on the physical place as well as the social place. So it's really important as Health and Wellbeing Board members, we think about the positive and negative impacts are the way our town is structured and our borough towns and our place is structured, and how that has an influence on people's well-being, because I think this is the opportunity we have to be able to put that influence into this strategic document, which is just a timely document. So I have got somebody working within Gavin's team to not infiltrate, influence influence the way we plan to think about the health impact. He's highlighted one particular one around healthy food environments, but there's such a range, and in a sense Gavin gave such a range in terms of the green spaces and mental well-being is absolutely crucial. So we all must think about how this really does influence our well-being in the town. So I welcome that, and I also welcome, I think in the last few years, I don't know with my NHS colleagues, but we have developed a stronger partnership working, I think, in terms of Gavin with his team, in terms of working with STP colleagues, in terms of looking at locations and sites and how we can plan together rather than separately. And by accident find it together. So thank you, Gavin.
Thank you.
Thank you. Julian?
I think Liz has just covered both the points I mainly wanted to make, but I mean, I think it's yet again another use of the word place, isn't it? But the impact of place on health is huge, isn't it? And, you know, for all the reasons that, you know, has been articulated and is stated about, you know, well-being, mental health, you know, the environment, transport, green spaces, just the design of buildings, all those things are incredibly important. And then my other point was about this linking in at a very early stage with the with what will be the ICS and, you know, at the moment the CCG around healthcare planning and planning of those, you know, healthcare resources that are needed. And I'm sure Dave may want to make a comment on that. I know that's done and that's linked in terms of our sort of primary care strategy, but primary care is key, and also obviously secondary care and the impact on the secondary care and community services that are being developed over the next few years.
Thank you, Julian. Dave?
Thanks, Kelly. Yeah, I mean, I'd echo what Julian and Liz have said, but I think we do need to be kind of cognizant of, as we move down the place-based approach, I think the type of facilities we need to start to bring services together in terms of social care, primary care, community services, including mental health, and indeed advisory services. So that kind of health hub approach may be more relevant in terms of some of that planning for the future.
Thank you. Anybody else? No? Okay, well, that's the end of the meeting. The next meeting is on the 25th of March at 2 p.m. That seems like a long time away, doesn't it? And thank you very much all for coming.
I think Alan's got another question, Kelly.
Oh, sorry, Alan. Didn't see Alan, sorry.
I have to admit, I put it up at the last second.
Catching me out.
if I could just ask the question, as part of the planning brief around health and well-being, those of us that have worked in the homeless sector realise that houses of multiple occupancy don't foster good health and well-being settings. And I wondered, from a planning sense, whether in fact there's anything being done to address the numbers of houses of multiple occupancy that are being used across the borough.
Yeah, it's something that is an issue in certain areas, I think. But the difficulty, Alan, is around the government's policy around permitted development rights. So it's something that might be a bit of a challenge to achieve through the local plan, but we have got it on the radar to have a look at and to see what we can do around that. But yeah, it's a bit of a challenge, I think.
Yeah. Okay, I mean, we have been talking about the need for more single units of accommodation, self-contained, rather than seeing houses of multiple occupancy grow and grow and grow, because they don't foster very good health and well-being settings, really. So yeah, thanks for that.
It's fine.
Thank you. So yeah, we'll see you all in this meeting next year then. Thank you so much.
Thanks, Kelly.
Thank you.
Take care.
Thank you.
Thanks, Kelly. Bye.
Bye.
Bye.